I'd like to turn this over to Daniel Wolfson, Executive Vice President, COO of the BIM Foundation, and Dr. Lisa Letourneau, who you may know as our physician consultant, but who also acts as the Senior Advisor for Delivery System Change at the Maine DHHS, and who has been very involved in vaccine planning. Again, we welcome your questions and your comments in chat, and I'll turn this over to Daniel.
Hi, everybody. Glad you could join us. I'm going to kind of interview Lisa and have a conversation with her, and then we'll do that for a few minutes, and then we'll turn it over to you for questions. Lisa, just to get a feel about what you do on a daily basis, could you describe what you were doing yesterday?
And this morning.
And this morning.
Yes. Yeah. So, it's been a fascinating intersection for folks who have been on these calls. You might know I've served as an advisor to Choosing Wisely for a while now, but my day job is actually as a senior advisor with the Maine Department of Health and Human Services, where I've supported a range of sort of health transformation efforts, which Choosing Wisely has been very relevant for. And now with COVID, have served as a resource for a variety of COVID-related issues, from testing and all kinds of issues, and now most recently vaccines. So I think Daniel is referencing that I helped to sort of fill the gap and serve as the clinical lead for a mobile FEMA, the Federal Emergency Management Agency vaccine unit, where I've been joining that unit out in some of the rural areas of the state to offer access to vaccines for people who have not otherwise found a way to get them. So yes, I was on the FEMA ban yesterday and today.
So Lisa, what surprised you, or your reaction to what you heard from Sarah?
So I have to acknowledge that I've been a real fan of Dr. Quinn for a while, and we've had her present on some of our Maine DHHS webinars with clinicians as well. And I've followed her along in her writing. So I'm not sure that too much surprised me, other than, once again, what a great job she did with it. And I guess some of the progress that we've made in some of the diverse communities as well is a pleasant surprise. But I just think that her advice is just so well grounded in her own research, what we've learned from flu, that there is so much to learn from our age-old friends like flu vaccine, and that can be applied to COVID vaccination as well.
So Maine has the highest rate of vaccination in the country right now. And so what's behind that success of Maine? What are the factors that have contributed to that? And what are your challenges?
So if I have any colleagues from New Hampshire, they're probably ready to challenge that, because we keep going back and forth literally day to day. But interestingly, Vermont, Maine, and New Hampshire are all doing quite well and pretty similarly. And I think in many ways, we don't know for sure, but I think in many ways it is very much an echo of what we heard from Dr. Quinn, and really from what the Choosing Wisely now building trust, right? That it's trust. I'm sure we have, other advantages in terms of a relatively small population, but I think, and in Maine, actually, and similarly in Maine, in New Hampshire and Vermont to some extent, we don't have a widely diffused public health system. Interestingly, we don't have county health departments, and so for a long time, and including with this, we've had to rely on partners with the healthcare system, and in some ways, I think. People know that and they trust that. So the larger health systems and the hospitals and the federally qualified health centers, other independent primary care would like to have done more, but we just have not had the vaccine supply to engage them a whole lot yet. But in any event, these healthcare providers have been largely the sites where people have gone, in addition to the direct allocations that the feds have made to the commercial pharmacies. So some of the pharmacy chains in the state. But I think, the fact that we've got a pretty widespread distribution system in terms of multiple sites, multiple large-scale sites from some of the health systems, I think those providers have done a great job in terms of making it relatively easy for people to, book vaccines. And now trying to supplement that with other resources like this FEMA asset. So literally it's a van driving around to rural areas and making it available to people who maybe haven't been able to get in otherwise. So I think, yeah, relatively easy access, providers who they trust. And then also, we kept to a pretty simplified system. So in other states, there were different routes or methods for following the ACIP recommendations for priority group, 1A, B, 1C. But our Governor Mills, decided fairly early on that the highest predictor of mortality from COVID was age. And given that, she actually adopted a strictly age-based strategy. So we started, with 70 and older, and 60, 50, but before moving to the high-risk conditions, of which, I think there's been a lot of good work to identify that, and yet it creates a lot of complexity in the system when people have to either, attest that they have one or more or two or more conditions, and which one, or in some states, I know they've had to get attestation from their physician or clinician. And it just, while I'm sure there are good justifications to be made either way, anytime you add complexity to the system, it makes it harder, and it potentially makes it harder for people with less resources, I think, to access vaccines. So it was simple, it was straightforward. Now it's 70, now it's 60, now it's 50. And then it was just all ages. And we were able to move to all ages a few weeks ago. So I think there's definitely something to be said for that in terms of helping the numbers as well.
So right now it's open to all ages up to
Yes.
16?
Yes.
And
As of
who-
April 7, it's been open to all ages. Yep.
April 7th. So what groups are lacking vaccine confidence or vaccine hesitation? What groups do you see that you need to work with and listen to at this point?
Yeah, and I think it's pretty similar to what Dr. Quinn described. In Maine, we are sadly also one of the whitest states in the nation, so we don't have huge numbers of racial, ethnic, diverse populations, but certainly some, and particularly in some of our I hesitate to call them metropolitan because they're still so small, but in some of our larger cities, Portland and Lewiston, for example, we do have quite a number of people from diverse communities. And there's certainly been some hesitation there, but we've also had great partnership and trusted voices from those communities speaking up in support of vaccination. I think we are probably likely to face the bigger challenge, as Dr. Quinn noted, from our rural populations, and particularly for middle to older age white men. We also, even though we're open to all ages now, it's pretty new in terms of the younger age group. So I think we still have to see what shows up in terms of the willingness of the younger population to accept vaccines. So when we look at our county, our uptake by county, we certainly see some differences. The more rural counties are lagging behind the more, again, urban counties. So that's definitely a challenge. But I think that white rural male is likely to be a challenge for us as in other areas of the country.
And so what are some of your messages to some of those groups, and who are the messengers?
And again, echoing, much of what we heard from Dr. Quinn, that vaccines are safe and effective. They have been well studied. We haven't shortcut, the federal process has not shortcut safety. And I think probably most powerfully, getting more people vaccinated is the fastest way to end this pandemic. In Maine, as with all over the country, right? People are fatigued, sick of being, having to undertake the measures and isolation. So over and over, really trying to stress this is the fastest way to get out of this. Maine is also known as vacation land, and we're eager to have visitors in the summer. And again, I think, being able to say that we are a safe state or a place where there's a high rate of vaccination, I think appeals to that business mentality as well. In terms of the messengers, we've used certainly our trusted Dr. Nirav Shah is the director of our Center for Disease Control in Maine, and he is a very excellent communicator, very highly trusted in the state. So he really has been the first and foremost voice. We've also worked hard to partner with community organizations. So we've put out contracts actually to many community organizations who applied for funding specifically to help promote vaccine through messaging and through community-based efforts. So a lot of those in, again, the more urban areas have been organizations based serving diverse populations, and they've done a great job in terms of outreach into their communities, doing education. They were also involved early in COVID in terms of messaging and outreach related to COVID prevention and mitigation, messaging, education about quarantine and isolation. So they're known and trusted in their communities. I think we are also just on the verge of launching a wider public education campaign as well about the importance of vaccines. So that's coming soon. And that will also use clinicians and physicians actually as trusted voices there as well.
So what about the impact of the J&J pause, both on supply and on confidence in the vaccine?
Yeah, it's so unfortunate. I mean, supply, the good news, bad news, right, was that there already was a supply issue with a recent, production glitch that impacted. So the feds had projected that we were going to get a huge influx of J&J vaccine in April, and that already had faltered. And then this hit. I think I was sharing with you, Daniel, that we were at the FEMA mobile trailer last Tuesday, we're about to start vaccinating, and we were using J&J only, as that trailer goes around a big circle in rural Maine. It was going to be one and done, and we were going to use that exclusively when the news hit from the esteemed scientific journal, the New York Times, that the feds had put the pause on J&J. So we had to do a quick pullback on that and pivot quickly to Moderna. So from a supply standpoint, definitely an issue. Feds have said that they're ramping up production of Pfizer and Moderna. We'll be able to replace that, but we haven't really seen it yet. So that's a bit of a challenge. And then from a trust standpoint, I think, it's a challenge. And, I'm hopeful that we can overcome that. We were fearful that we would really see in some of our clinics over the last week a general pullback from a vaccine, but we haven't really. So that gives me some hope. I don't have hard data on that. But inevitably, affects people. It's hard to get the messaging across quickly and succinctly that, look, we need to put it in perspective, relative to the risks of COVID. This is still considerably safer relative to the risks that you take every day by getting in your car, by smoking a cigarette, by taking oral contraceptives if you're a young woman, right? But those are hard messages to get out. So it is concerning, I think.
Yeah. And now I have a personal question for you. I always go to Maine, and I always go to the July 4th parade in Round Pond. Will I be going to my parade in Round Pond, Maine this summer?
That's a great question. TBD, I think. TBD. I think the governor very much holds President Biden's hopes that people will be able to have a happy and normal July 4th. But I think it's going to be the difference between public, large gatherings and private, small gatherings, right? So to the extent that we can get folks vaccinated, people feel more comfortable in small gatherings, great, but large groups, maybe not. So I hate to say it, Daniel, you might have to play a replay of an old video for that one. I'm not totally confident. You could go to Round Top Ice Cream though and soothe yourself that way.
Certainly had a huge impact in 1918 in Philadelphia when there was a parade. Right. We should learn from that, right? So there are some great questions here, and I'm going to start with Richard Frankel, and I'm going to let people unmute themselves. I always like to hear the voice of the Richard, would you like to give your question?
Sure. Thank you, Daniel, and thank you for a wonderful talk. So my question is that there are estimates that up to 40% of nurses who work in long-term care facilities are vaccine hesitant. And I'm wondering, within the professions of medicine, nursing, PT, OT, so forth, how we engage those people who may be at risk to themselves, but certainly are also creating risk for the patients that they're responsible for.
Yeah, so we've tried to tackle that in Maine in several ways, and I think honestly the answer for many of these groups is it comes back to that trust issue, right? Who do they trust, and how do you set up ways for them to have safe and comfortable conversations where they can ask their questions, not feel like they're being pressured. So what we've done in Maine is to, number one, we host. It was weekly, now we've backed off a little bit, but calls with the medical directors and clinical staff. So the lead, say, chief nurses, clinical staff from long-term care facilities across the state, where we provide information and help to answer questions that they can then go out and hold conversations with their staff. We've also brought state resources, myself, CDC staff, to join in, Zoom-based conversations with staff of those facilities several times, numerous times, so that anybody can join, ask questions. And it really feels, over and over when we do this, that you see people move in the course of those conversations. If they feel like they're getting trusted information from a trusted source, they can ask their question. Nobody's making fun of them. Nobody's, making light of their questions, and they'll often say at the end of it, wow, I didn't know that, or I didn't have I've never had a chance to ask somebody about that, or I never got access to that information. We literally have a slide that compares the 3 vaccine, what's in them, what are the additives, what's not in them, all the, and calling out the active misinformation campaigns that no, there is not a pork product, no, there are not microchips, right? The things that they're hearing from those competing sources of, through social media. So finding ways, I think, to have those conversations either as groups, as organizations, within facilities themselves. And we also always try to frame it as, we're not trying to convince you to get the vaccine. We're trying to give you the information you need so you can make your decision about whether you want to get the vaccine. And then certainly stressing also the, the benefits that they get from getting a vaccine, whether it's not needing to quarantine. I mean, the state and the feds, right, have changed the requirements. If you are fully vaccinated 2 weeks out and you're a close contact, in previous times, right, they would have had to quarantine for 2 weeks. And for a lot of those frontline workers, they can't afford to do that. So the fact that being fully vaccinated gives them that benefit is huge, depending on the facility and their policies, but that is increasingly, the case for some. So trusted voices. Many of in Maine too, many of our frontline workers come from racially and ethnically diverse populations and communities. So again, having those conversations happening through their trusted community leaders, through religious leaders, is another, sort of amplifying voice around that.
So I wonder if could I follow up with a quick second question?
No. Go ahead, Richard.
So I take your point about trust, and I wonder, this may just be splitting hairs, but it feels to me like there's a difference between faith and trust, and especially blind faith and trust, and how to work with people who are faith-based and may have a different idea about what trust consists of.
It's a very good point. We have found, again, here in Maine, that most of the faith-based leaders, religious leaders, are open to conversations. We also hold regular calls with them as well to be able to have those same conversations, answer questions. There are a few, who are at the other end of the spectrum and, are saying out loud to congregations that they should only have faith in God and not the vaccine, but they are a minority, and most we have found are open to conversations about scientific evidence. So I think trying to engage them, having them, inviting them to be part of the conversation is key, and we're not going to get them all, right? Just like the population.
Thank you so much.
Thank you, Richard. Jasmina, can you ask your question? Unmute yourself, or I could do it.
I've unmuted myself. Yes, thank you. I'm a manager of a team of care coordinators, and we have many patients who are homebound, and they are being seen by a home care physician who brings with him a whole entire team. And initially, there was a tremendous amount of hesitancy on this population to get vaccinated. Comments such as, I'm old already, why do I need it? I live alone, so I'm not going to come in contact with anybody. I'm sick as it is. Are you trying to kill me? No, that's voodoo medicine. It's full of whatever there is in there. I don't trust it. So we went from that, and with frequent conversation with these patients and talking about the flu vaccine and their acceptance of the flu vaccine, we've gone from hesitancy to hurdles. It's how to get the vaccine to this population of patients.
Yeah, it's absolutely a challenge, and great to hear that there's progress, at least in willingness. In Maine, the two primary strategies that we've used for that, and I'm not sure exactly where you are, Jasmina, but are home care agencies and actually 3 home care agencies, independent pharmacies, and EMS. Units, and probably the biggest has been home care agencies, where they literally have gone home to home. It is definitely a challenge. It's resource intense. There's also the issue of the different vaccines being stable at room temperature only for a certain period of time, so they really have to line them up and make sure that they're getting to all 10 for example, within a certain period of time. But we've had pretty good luck. We've also used our Office of Aging and Disability Services to identify people who are identified as homebound and receiving services, to sort of tee up those lists and not wait for people to ask, but to proactively identify populations in need of that. So we've had pretty good luck doing that. I'm sure there's more who we need to reach, but pretty good luck using those strategies.
Thank you.
Tara Montgomery, could you introduce yourself and give your question, please?
Absolutely. Hello, I'm Tara Montgomery. I was involved in the first launch of the consumer campaign for Choosing Wisely, so I know some of you from that. And I've continued to stay in touch with the foundation because I work a lot on trust in my own work. So I have a question about the kind of difference between an individual decision and a kind of more altruistic community decision. And I'm really struck by how most conversations are about the personal risks and benefits rather than herd immunity and kind of what it means if we all get vaccinated, even if we might risk getting a blood clot or just feel scared of a needle or whatever. So I wonder what advice you had or what insights you had into whether the message of helping other people has an impact among people who are hesitant as individuals.
Yeah, it's a great question. And I think the research would support that those values vary by group and often by ethnic group, race, and age. And I think the key part is having the conversation with people about what's important to them. And for some people, it really resonates well. And again, that tends to align with some ethnic groups, and with others, it's really about their individual, that they just don't. And I think, we see that in some of our sort of political alignments as well, right? What's good for society, what's good for the group, what's good for me individually. So I think trying to elicit from the individual what's going to be most important, and then trying to make the argument that way. But it's highly variable.
Okay.
Bill, you had a comment, but you also had a question about the correlation. Bill, could you introduce yourself?
Sure. Hi there. I'm Bill Adams, and I live in West Central Minnesota. I was previously involved with Choosing Wisely on a number of levels. And I'm just curious if there had been any observational stuff or actually any studies of whether there is any correlation between vaccine hesitancy and mask wearing. And then the comment I made was that Minnesota, when they rolled out the vaccine for a while, was way in the bottom half of vaccine distribution, and then went up to the very top of the list and has ranked either 1 or 4th or 5th consistently for a while. I don't know how we're doing in reaching underserved communities, but I've seen some successes in poultry packing, meat packing, that sort of industry, of using people within the community itself, within those marginalized communities, within the Hispanic communities, which are reluctant to identify themselves, using people within those communities to go simply go door to door and be able to get the vaccine without any appointments on that day. So.
Yeah, that's great. Hello, Bill. We go way back. And I love competing with Minnesota for high health rankings. We're usually chasing you, so I probably will again. So in terms of your question about correlation between mask wearing and vaccine hesitancy, I have not seen data on that yet, but boy, anecdotally, I would say absolutely, right? I mean, it's unfortunately some individuals, populations that are still COVID deniers, right? That don't believe it's real. I mean, it's out there. There's no question. People still say they don't believe it's real. So why would I wear a mask? Why would I get a vaccine? You're all making this up. I mean, I suspect that is a very strong correlation. I'd be shocked if it weren't. And even public, individual right? It's my right not to wear a mask. It's my right. And again, those are often individuals who don't necessarily believe in the public good. And unless it's, I'm not going to get sick from it anyway. I'm young, I'm not going to get ill. So why would I bother? So I suspect that there is a strong correlation.
Is there any more questions? I have a question that I could give, but I want to know if anybody else has a question. So what's the discussions about passports in Maine?
Oh gosh, we have not really got there yet. Honestly, the focus has been so much on vaccine. I am not aware that there's been any sort of policy stance or decision on that yet. So
I anticipate by July 4th we might be hearing about that.
There we go. Hey, not related to that, but I was going to go back to one point about clinicians and primary care, because I know you referenced that, Danny, or actually I think Dr. Quinn did as well. And I was just going to say, I don't know how that's going in other states, but that has been a real challenge here in Maine. So both from a sense of needing to prioritize vaccine while we're still under relative level of constraint, not feeling like we don't have enough, to the higher volume sites versus primary care. There's certainly the direct allocation from HRSA to FQHCs, but in terms of state distribution, it has not widely been to primary care yet. So, the comment, I think she made the comment, we need to be able to talk to people and give them vaccine right off when they're ready. Unfortunately, primary care, a lot of our primary care and other clinicians have been somewhat frustrated. They haven't been able to do that. And at the same time, acknowledge the operational realities that because of the multi-dose vials, it is hard to make sure that you can get all 10 doses out, within a couple hours, or that you have the appropriate refrigeration, or that you have the staff to both explain the consent form and do the 15-minute to 30-minute observation in a busy primary care practice. So there's definitely been some challenges there. We have a few practices that have been able to do what we've been able to give to some. And again, the FQHCs have had more access to it. But I also heard a really fascinating idea the other day, just this week, from one small health system that came up with the idea of giving a golden card or a gold ticket, the golden ticket, like the old Willy Wonka. They said they almost gave a chocolate bar with it, but basically they leverage that relationship of trust between the primary care provider and patients to have the conversation. And if somebody was hesitant, particularly older adults who had not, because in Maine, you've had plenty of opportunities if you're older to get it. So if you are older and have not got a vaccine yet, by definition, you're somewhat hesitant, if not, among the homebound, but mostly you're probably hesitant. So to use that relationship, if they can have that conversation, have the person decide to get the vaccine, primary care literally hands them a golden ticket and says, go to the vaccination clinic down the street or, in the other side of town. And you can walk in with this ticket right now, and they're going to bring you right in. You have special status. They're going to, and essentially they just register them on the spot and fit them in between other appointments. And I just thought that was brilliant in terms of leveraging trust, taking advantage, because right, if you have that conversation with somebody who's reluctant, you get them to the point where you accept it. And then you say, call this number and, wait on hold and make an appointment for a week from now or 2 weeks from now. And, you just know you've gone down several, had several voltage drops there in terms of acceptance once they leave your office. But if they feel special and they're fresh from that conversation with their provider, I just thought that was a brilliant strategy.
Thank you for attending today. And thank you, Lisa. What great answers. And you know, we heard from Sarah kind of in an academic setting and with some research, and then to hear from Lisa on the ground was just a great combo. So thank you.